Hi there. Today on Mushroom Hour, we have the privilege of interviewing Ian Geithner, who is a graduate student at the University of Maryland working in the Johns Hopkins Psychedelic Research Unit under the mentoring hand of Dr. Roland Griffiths. And for anyone who isn't already familiar, Dr. Griffiths has become a leading figure in the modern psychedelic conversation through the psilocybin-assisted therapy studies that he has been leading for the past 10 plus years. These studies sparked scientific interest around the world, and I have seen his work as a major element in shifting the modern conversation around psychedelics into the realm of legitimate medicine and therapeutic treatment. Dr. Griffith's studies were a precursor to the Johns Hopkins Psychedelic Research Unit, which is a newly established center where researchers focus on how psychedelics affect behavior, mood, cognition, brain function, and biological markers of health. Ian is here to share more about the center and his experience in entering this cutting-edge field of research. Ian, welcome to the show.
Hey, thank you. Thank you for having me. It's an honor to be here.
Well, the privilege is really all ours because this is something I've been interested in for a long time. Obviously, with my interest in mushrooms, when I saw some of these studies coming out, catching headlines for psilocybin-assisted therapy, I had to read about it. And so when we synchronistically met via Instagram, I was so stoked to get you on the show and learn more and hear it from the viewpoint, maybe of not Dr. Griffith himself, but someone who's on the front lines, getting interested in this. And so I want to make sure that as much as we talk about the research unit, we do it from your perspective, because I think that's really interesting. So to start the story of Ian, I guess, what was your educational background, or what was your early life that kind of set you on a path, maybe to the sciences or maybe towards psychedelics?
Sure. So I guess I'll kind of start with the sciences and then get more into my education history as I go throughout my ages, I guess.
There's no wrong way to do it. It's your story.
So, yeah, and that's right. I appreciate that. So I grew up with two parents who are very science-minded individuals. My dad actually is a project manager for the James Webb Space Telescope with NASA, and so he's very much an engineer and a scientist, and so I got to always ask him questions growing up and learn to be a scientist, I guess, from him very much so. And then my mom, she's also very science-minded, and she's now a massage therapist, but she used to work in a hospital lab doing microbiology, and so she would like read panels and look at like biological specimens from patients, and it's pretty cool stuff. And so I very much from that was interested growing up in the sciences and also medicine, and particularly medicine, which kind of goes hand in hand with my history with my own personal ailments. I've been dealing with chronic pain now for just a little over 9 years. It started in the fall of 2010. So it's been a while now, but yeah, I mean, it's been a large part of what has inspired me to pursue medicine in general. And so as I went into undergrad, I was actually a nursing major, and then I changed my major around a little bit and ultimately settled on biochemistry. And that that's something that just really intrigued me, and I like to understand things, and I like to understand the body and biology, and just how we function. And so biochemistry really was a good fit for me there. And
so you're in a house full of scientists. I imagine going that science route, aside from your innate interest in the body and in biochemistry, was a pretty easy groove to fit into because you're raised around it. That mindset, I'm sure, kind of permeates your life, that kind of questioning scientific mindset. And then you said coupled that with some chronic pain. Now, was this, I guess, just a little bit about that? What was the nature of the chronic pain? And the reason I ask is, we're talking in this bigger realm of kind of psilocybin. We're going to get into psilocybin assisted studies. And I know that's one thing that people ask me about is they say, I don't know why they assume I'm an expert on this, because I'm totally not. But they ask, are there therapies using psilocybin for chronic pain what was the chronic pain that you were dealing with?
Sure. So it took a long time to figure out exactly what was going on. I actually only got a final answer in 2018 in October, that I actually have a genetic disorder called Ehlers-Danlos syndrome, and I have the hypermobile type. So my joints are hypermobile, and so it's a complex of collagen affecting disorders, and so that, coupled with being very much a high level athlete in martial arts, specifically Taekwondo, and as well as being a gymnast for some time, it kind of took its toll on my body, because I was just more prone to injury of my joints, with my joints being hypermobile. So all of the overuse and just repetitive motions from those sports, as well as running, which is something I really enjoy, but can't really do too much of. It just causes some wear and tear.
That's really hard for someone who's an athlete. Anyone who knows athletes out there, they kind of communicate. You use your body to communicate. It's like a really important tool for how you interface with the world, how you live your life. So if you have some kind of chronic pain for 8 years without identifying what it is, I'm sure as you progressed through school and through your studies, I'm sure you were keeping an eye out for maybe something that could help you, maybe something that you could use to address kind of your own I don't want to say issue, but some of the things that were affecting you.
Definitely. I mean, that's really a large part of my inspiration for the things I've been interested in. Before I was interested in, the work I'm involved with now, I was interested in orthopedic surgery, because I've had my own like hip surgeries, and I don't know, I just felt like that was something I could do well in and be able to relate to patients with, and just be real with them.
Sure.
But then, I kind of had a realization later on in my life that the hip surgeries I had didn't really, they weren't a perfect fix. I still had pain afterwards, and it was almost like I had a new type of pain from the surgery. Part structural abnormalities were fixed, but there was other stuff going on, and dislocating a hip with hypermobile joints, not knowing that, can also cause an issue.
I mean, that just sounds really painful, and I'm sure along with the physical pain, you get that kind of mental and emotional pain, especially when you're an athlete doing the things you love. I'm sure there's kind of an element of that comes into the mental and emotional side. That those kind of pains that we are still developing tools to deal with. So I guess from all these coalescing of factors, how did that lead you into a place where you start looking toward any kind of psychedelic research? I mean, obviously you've got the academic background, it sounds like, but kind of how did these factors come together to lead you towards psychedelic research?
Sure. So I guess, after my interest in orthopedic surgery kind of waned, it was as my interest in psychedelics was growing, and part of that was because of a realization for myself that what helped me more than anything was actually a psychological shift rather than an alteration of my physiology. And so that realization for myself was really powerful, because then I saw, psychiatry, like that's where I should, put my focus, because, regardless of how much, my body hurts from the physical problems that I have, there's just the debilitating emotional and cognitive component to it, and ultimately it's your perspective on your pain, I think, that is going to determine your experience with it. So if you can accept your pain, it's a lot easier to deal with it than if you're very rejecting of it, and essentially rejecting of yourself, your past, maybe things you've done, and that's not a healthy way to live, because then you're resenting your own self, and you're your own worst enemy. And I lived that way for a long time, and I realized that that wasn't the way.
I've heard that from a lot of chronic pain sufferers, that there is kind of this mental and emotional state you have to get into where you are accepting of your pain, because if you stay there fighting it, it only makes it worse, and it kind of makes it your identity. It's kind of not only you're not sublimating the pain into the greater, Ian. It's like, no, my life is a war against the pain, war against myself, like you're saying. So out of that, I can see how, different alternative treatments and different, avenues of dealing with these kind of issues would really become appealing. So I guess where did you do your undergrad? Where did you do your undergrad studies?
So I went to Towson University, which is in northern Baltimore, and yeah, I had a really great experience there. I really had an opportunity to learn a lot about myself, and like I said earlier, I changed my major a couple times, and I part of that was also just gaining some confidence. Like, it was a professor that actually encouraged me to go to medical school and to shoot for that rather than for like being a nurse and going to like nursing graduate school. Not that there's anything wrong with that, but she really saw potential in me and encouraged me. So the 4 years I spent at Towson were very important years.
Now, from there, did you jump into the graduate program at Maryland? Kind of what was that next few sequence of events, or maybe it's a lot of sequence of events that led you to working with Dr. Griffith?
Sure. So I guess it was in 2016 in the fall that I kind of made it was like my dream goal to work with Roland. I had recently read a book by a colleague of his, of now mine, Bill Richards, and he wrote this book, Sacred Knowledge, and Sacred Knowledge, Psychedelics and Religious Experiences. And I mean, I don't think I've ever read a book so fast. It was such a great book that really just changed my life. I mean,
just so I can write it down, everyone else can too. What was the name of it again?
Sacred Knowledge, Psychedelics and Religious Experiences.
Perfect. So you devoured this book and thought, I need to connect with these people.
Yes. And so I was just, I just kept looking more and more into this research, and just became very much intrigued with this work and the experiences that people were having in these, research trials with psilocybin. And it largely talks about, in the book, Bill actually, he talks about his own use in, when he was in undergrad, or it might have been in graduate school, but he discusses that, and that's what kind of got him interested. Was he participated in a research trial at the school he was at in Germany at the time, and then he talks about the experiences of patients in the studies that he was involved in at the Spring Grove Mental Hospital, or Shady Grove Mental Hospital, in Baltimore, Maryland. And then also he talks about the cancer study largely that we conducted at Hopkins, and just the experiences people were having and the outcomes they were seeing, and just the changes that people were experiencing were very profound. And I just was very attracted to that. And so yeah.
I was going to say, we all want profound experiences. I mean, we all want to have those kind of transformational experiences for ourselves. So I'm sure reading that book kind of immediately grabs you, and you think, I've got to do this. Now, with you having the background to kind of be more involved professionally, potentially, how did it then turn into you working with you? I mean, that would seem to me, that would seem like such a dream, is to read a book that inspired you so much. And you're like, now he's a colleague of mine. So, I mean, did you just run out, like go knock on his door? Dr. Richards, we need to talk. How did it then progress from there?
So I actually kind of sat on the decision in my mind, like this path that I saw before me. Because this was before, I guess, my family had known that my interests had shifted towards this area. I think I may have like expressed I was interested in psychiatry, but didn't necessarily express the whole story. And so I guess I just wasn't sure how they would react. But all my life they were encouraging me to do what I was passionate about and what I was interested in. And so eventually I just like I made the decision. I was like, I'm gonna do it. I'm just gonna email Roland, and I'm going to because I found out more about the research. I figured out he was the principal investigator for the majority of the studies, and so I sent him an email, and I think it was March of 2017, and I heard back from him after some time. And I was reaching out. I asked if he had any openings for an internship position, and and then I got some interviews, and then I started in the summer of 2017.
I see. I love a story like that because it really shows that sometimes when you're passionate about something and you just commit and don't be afraid, because we all want to do certain things. And sometimes we kind of psych ourselves out. We're like, no, there's no way I could get involved. So yeah, sometimes just write the email, knock on the person's door. I mean, do whatever you have to do to get involved with what you're passionate about, and the return will be magnificent. And I also think it's interesting, kind of not to joke about this kind of thing, but like coming out of the psychedelic closet to your parents, being like, "Hey, mom and dad, I'm really into psychedelics." What was their reaction? I mean, were they loving and totally fine with it, or what was their reaction?
It was overall really positive and accepting. I think at first they were like kind of confused, and like my brother in high school had a negative experience with mushrooms, and so like that was very much kind of what they associated just like that with
Sure. The first association was your brother's bad experience, but I'm sure once you provided them with like some literature and there's intellectually there's a lot of rigor to this, and this is a real thing, guys.
And so being people who are open-minded and science-minded as well, they they could see the evidence and come around and accept it, and now they're very supporting still, and I'm very lucky to have them.
Well, you're lucky to have supporting parents. It's awesome when you can get them on board with what you love to do. So you wrote to Dr. Griffith, and he just lets you in the lab there at Hopkins. It's like, come on in, let's start this research. I mean, when you started, I guess, kind of how did you start out, and then how did you kind of grow with him as the actual Center for Psychedelic Research came together?
So I started as an intern working not very directly with Roland. For a very long time I was like so very much like starstruck, like
I can imagine.
Yeah, and so I was just so nervous to even talk to the guy. It was insane. I would get mini panic attacks just like at the thought of going up and talking to him, just out of the amount of respect I have for him. And
sure, he was your hero. I mean, or one of your heroes. Yeah,
definitely. And so I started out working on a project that was a survey study, and I still am working on that a little bit. And it's we call it the Death Survey, and so it's a survey that has collected about 4,000 responses from people who've had drug-induced experiences, and about 1,000 from people who've had non-drug-induced experiences, naturally occasioned experiences that ultimately resulted in a shift in their perspectives of death and dying. And so that was a really interesting project to be a part of. I essentially got to read through, 4,000 plus trip reports of people who had these interesting experiences. And
And these are people from kind of all walks of life, or I
yeah,
mean, they didn't have illnesses or anything, or did they?
some people, reported having, certain illnesses. Like there was a considerable amount of people, I would say, that had expressed they were depressed, and actually, and that they had sort of as a last resort, gone to experiment, with the psychedelic, whether it, was mushrooms or LSD or something else,
Mm-hmm.
and actually came out of those experiences, most of them, with a very changed perspective and different outlook on life, and saying that their depression from 5, 10, 20 plus years had gone away. And that's profound.
That's really profound. And if you ever had a doubt that this was the path of your interest, I'm sure that kind of went away when you got involved in this first survey and you saw really profound psychological effects like that. Because, those are things that, like I said, we're still developing long scale therapy, still developing ways to basically change your mind. So that was a seminal study for you, it sounds like. Were there any big takeaways or anything? I mean, you're staring at the other side of the veil. You're helping people kind of look towards death, which is something we all have to face. Were there any takeaways for you, or things that you think were commonalities between these people's experience? Obviously, we're kind of talking anecdotally for Ian. I don't want you to speak for the center or conclusions or anything, but what were some of your takeaways from that first study that you were involved in?
So, like I said, we're still working on it. It still hasn't published or anything, but just from, my own assessment of having read through all the different experiences people had, I would say it kind of helped, it in a way helped reshape my own perspective of death and dying. Right around when I had started, very shortly after, actually, I had started working with, working as an intern with the unit. I experienced a lot of loss myself, and particularly my grandfather, who's kind of my biggest role model growing up. He passed away in August of 2017, and then I had a friend of mine who actually committed suicide, and so it was a difficult time, but an interesting time to be working on the project I was working on. And I sort of, I guess, started to reconceptualize my own ideas of death as seeing it as something that's constantly, continuously happening. It's the other side of the coin of life. And so,
Right.
yes, like there is the cessation of life, at the end of a person's lifetime, like when you actually die. But, as you're living, you're constantly changing. And to me, that's sort of a process of death, of change. And, it's,
That constant entropy,
yeah,
kind of syntropy that brings us into the world, then an entropy that kind of gradually takes us out. And so that is really powerful to be studying these people's experiences from the other side as you're dealing personally with loss. I mean, that's even more seminal of a thing in your life than I could have imagined. I didn't know that about you. So from this experience, then, like I said, I'm sure you were more committed to the path than ever. So what then happened moving forward? And I guess I do want to get into, when did the Center for Psychedelic Research get formed in its current incarnation? And, my questions start to go out into, like, did it get bigger? How big is it? What other studies are going on? So we can talk about kind of the center, but we can definitely transition for how you got there.
Yeah. So I worked as an intern for about a year, and then I actually started working full time at the unit that all of this research has been happening in at the time, and it's still a part of, which is the Behavioral Pharmacology Research Unit.
Okay.
And so I was working in a different lab with some different research, actually on a pain study, which was interesting to be a part of, inflicting pain on healthy participants while, I'm sitting there dealing with my chronic pain,
Right.
And just like, it was definitely an interesting study to be a part of. And I do have to say, though, I am happy to be in the psilocybin lab. It is sort of the dream come true. And so after working for a year in that lab, I got brought up into the psilocybin research lab or a psychedelic research lab as a full-time research assistant there. And and that was in like June, July of last year, 2019. And
Well, congratulations. So I guess that means you get to be interfacing with your hero, Roland. I'm sure you're kind of over the starstruck aspect of this at this point, but I mean, I'm sure there's tons of other people that you work with too. I know
Definitely.
Roland's the figure that sticks out in my mind, but I'm sure there are tons of people involved in this research. So as things stand today with this unit that's kind of researching psilocybin, and I understand that the Center for Psychedelic Research overall, maybe this behavioral pharmacology research, deals with more substances, obviously, than just psilocybin.
So we are the Center for Psychedelic and Consciousness Research is a part of the BPRU, and so
Okay.
we specifically, we're focusing mainly on psilocybin, but there's actually been some studies with salvinorin A, the primary compound in salvia, and Salvia divinorum, and so the Behavioral Pharmacology Research Unit overall looks at a lot of different things. So we actually have a large cannabis research lab. We have some opioid researchers. We have like nicotine researchers, and there's a lot of stuff that we do, and a lot of really interesting work that I get to see and hear about. Although I'm not directly involved with it, it's really cool to get to see some other research too.
Well, it's just interesting for me to hear that these things exist in an academic setting. I mean, it's been this way for a while. Obviously, there's a long history reaching back to, the 50s and 60s and probably even earlier, and having people really study these substances, whether it be psilocybin or other entheogens or just other substances in this academic setting, things we associate somehow with like recreational drug use or things that wouldn't happen inside that kind of atmosphere. So that's just really interesting to hear about. And, I'm curious then about some of the takeaways, some of the things you guys are studying that you're looking at. Obviously, we've referenced a couple of times psychological and emotional issues that don't have necessarily definitive treatment. And some of the substances you just referenced, psilocybin being the primary one, would seem to be preferable to me than some of the other pharmacological agents that are out there. But obviously, you need to make sure they're efficacious. You need to make sure it is safe. So that kind of roundabout phrase of verbiage I just threw out there is all to ask, what are some of the studies being done now in the psychedelic research unit, or maybe just in your area of it? It's probably what you can speak to the best. But what are some studies or some issues that you guys are looking at in helping people with using psilocybin?
Yeah, so we have a lot of studies right now that are active, and they're mainly clinically oriented. So they're looking to, resolve or see if there's potential to help resolve some sort of clinical issue. So I guess just to list them off, we have a smoking cessation study for people who are smoking cigarettes. That's actually it's in a phase 2 clinical trial state right now, and that's one of our longest running studies so far, and definitely has shown a lot of really great results from the papers that have been published so far. We also have a study that is now recruiting participants who are suffering from anorexia nervosa. So
Wow.
yeah, it's definitely something that is, you might think to yourself, it's a little strange maybe, but there's certain evidence to suggest that maybe it might help these people be able to change and move through the processes of change, and kind of we're adapting it with a framework of uh, motivational interviewing. And so it's not a huge component of it, but it's a way of helping people move through the processes of change. And so it stems from the trans theoretical model that that just identifies the different stages that a person can be in about change. And so the earlier stages are there's pre-contemplation, which is like before you're thinking about change, and then eventually on the other end of the spectrum, like when you're really ready and like want to change and are actively proactively like doing stuff for it. And so that's an interesting study. But
yeah, it sounds like a really interesting regimen of treatment. Obviously, I'm sure for every clinical issue or symptomology you guys are looking at, you're using, different processes but that one in particular sounds really interesting. And just the fact that you'd be looking at anorexia when that's something that, is pretty overlooked or ignored, or, I unfortunately in my kind of immediate frame of reference, I don't think of it as a serious illness. I don't categorize it with, severe depression or I guess for that matter, I don't think of smoking that way either. So, you guys are looking at some things that really maybe aren't even being examined as psychological or, issues that are really pertinent that we do need to look at, probably because there hasn't been a good way ever really to deal with it. So
exactly. Yeah, I mean, with smoking cessation, like the leading pharmaceutical is Chantix, and its efficacy is like 1 in 3 people who use it maybe successfully quit smoking, but some of those people ultimately go back. That's only looking at going out after they've used it a certain time. There's
right.
time past that's not assessed, that people may be relapsing later on in life. But like with some of the earlier results with the studies we've done with smoking cessation, it's shown that like I think somewhere on the order of around 70% of participants were able to successfully stop smoking, which is pretty incredible.
That's huge.
And yeah. And then when it comes to anorexia, so anorexia nervosa is actually one of the it's one of the psychiatric issues with the highest morbidity. So it has a really high morbidity and mortality rate, actually, because the body is so drained of its resources because the person's restricting their eating, and so their physiology is very much affected, and so it's dangerous, actually. And so and it's also something that's really difficult to treat. And so if there's something, if there's potential in psilocybin to help these people be able to better help themselves ultimately, then that's something worth exploring. So definitely it'll be interesting to see what it finds.
Well, and it's really inspiring. I mean, just hearing about 2 studies like that, where application of psilocybin, maybe with some other processes, in the case of anorexia, motivational questioning, maybe that combination of the chemical itself, along with some other, I don't know, not always verbal pressure, but some other things you can implement, some other processes that aren't invasive, is really interesting to hear that you can have really substantive results. I mean, that's super promising. And from just my intuitive level, I think, wow, that's an area of medicine that we need to explore. I mean, that sounds terrific. That sounds like a miracle kind of treatment if we could figure out the ways to apply it correctly. Now, just as a quick hit list, what are some of the other big things you guys, because I've heard of psilocybin used in PTSD studies, some things like that. So what are some of the other things that you guys are studying for psilocybin?
So we also are recruiting for a phase 2 clinical trial that's investigating the medical and safety effects of psilocybin in major depressive disorder. So that's a really big study that's being sponsored by an organization called the USONA Institute. So it's spelled USONA, and so that is a really major study because it's an FDA regulated study that will hopefully, take the next step towards the, medicalization of psilocybin for at least depression.
And usually, are these studies kind of sponsored by or maybe funded or organized or by a group like USONA, or how does that work? Are you guys kind of the academic toolkit, as it were, that can like do the relevant research, and then a group like USONA funds it, or how does that work?
Yeah, so USONA Institute has they're sponsoring 7 different sites to be conducting this study, and so with that, they're looking to institutions who are familiar with this research primarily. So that would be us at Johns Hopkins. Then there's NYU, who's also done a considerable amount of psilocybin research. And then Yale University, they have done a decent amount as well. And then let's see, there's a few other sites. There's a group called Segal Trials in Miami, Florida. There's Great Lakes Clinical Trials in Chicago. There's the University of Washington, Madison, University of Wisconsin, Madison. And thinking of Washington, I want to go back. And also UCSF out in California.
Oh, all right. Right on. That's my neck of the woods.
Yeah.
Well, and that's really interesting too for me, because it sounds like, we're getting a kind of a geographical snapshot, assuming the patients are drawn from those local areas, which kind of hints at future questioning. But it does seem like that's giving a snapshot of, running these trials in disparate geographic regions really gives you an idea of, is this working for everyone, or is it something about, the people in this area with psilocybin applied, like San Francisco with psilocybin applied, it kind of cures everything? No, we need to kind of test it in other places. So that's really interesting to me. So that was for the major depressive study. And then what are just a couple more of the studies that you guys are working on?
Yeah, so we have an Alzheimer's study, or mild cognitive impairment study. So that's a really interesting study. It's distressing to be dealing with, the loss of your mental faculties, and also for family members. So it's an interesting study in that it's recruiting 2 participants at once. It's a couple of participants. So like the individual who's suffering from mild cognitive impairment, and then a caretaker. And so it's not only going to assess the changes in the individual who is suffering from the mild cognitive impairment, who's receiving the psilocybin, but also to look at changes in the well-being of the caretaker, or family member, whoever it is, and see if there's a positive change there, because it really can take a toll on an individual's life who's the caretaker.
Well, absolutely. I think that's really a kind of a holistic, or a really great way to look at it, is not only for that patient themselves, but the emotional toll and the physical toll on the person that has to then take care of them. That's great to see that level of, obviously you're dealing with smart people, but just that level of cognizance in medicine to be willing to do that kind of research. And Alzheimer's is crippling for anyone who has it, for a family member or a friend. It's just absolutely devastating. And are there any results published from that study yet that look promising, or no?
No. So that is a very new study. So we haven't even had a session with any participants for that study yet.
Wow.
I don't personally have much involvement with that study, but it'll be really interesting to see what comes out of it. And then and as for other studies, I think that's it for what we are conducting that's clinically oriented at the moment. But we do have plans for other studies. So things like you mentioned, PTSD. We will also be looking at alcohol use disorder in the context of major depressive disorder. We'll also look at post-treatment Lyme syndrome. So the cognitive or the psychological distress associated with, Lyme disease, and, just like how, it's a pretty life-changing kind of
It's a draining. Yeah, now having known people now in my life that have had Lyme, I think it's weirdly getting a lot of attention recently. Like I'm hearing about Lyme everywhere. People are having more cognizance about it, and it is devastating for people. And it's this long-term. I mean, all the things you're talking about, whether it's something like Lyme that has a physiological component that leads to a really brutal psychological component. I think anorexia, it sounds like there's kind of that blend as well. I mean, all of these things would seem to be hard to treat without addressing that psychological issue. And some of them obviously are purely psychological. So what is it that's unique about psilocybin used in these contexts that really enables, change to happen? Or what makes it have the positive effect that it does on people? Is it just, they kind of get out of their own ego and are able to examine their situation from a more objective point of view? Is there anything physiological going on to the person's brains? I've heard about, your brain gets rewired, your neurons get remapped. I don't know how true that is, obviously. So what is it about taking that psilocybin that can make some of those psychological changes happen?
So I guess I would have to say that, we're still trying to figure that out. There are things that we have identified and have assessed, but, we don't ultimately know everything that's going on and, why everything is, happening the way it does. And, but with, like on the psychological side of things, people can sort of, after having the psychedelic experience, the psilocybin experience, people come out with, renewed perspectives on themselves, their lives, their futures, and so it's sort of a way to help a person reframe their life and just like their mind, and and that can really profoundly help a person if you're stuck in this negative thought, cognitive behavioral loop of thinking, feeling, and behaving in a certain group of ways, and and it's really hard to step outside of that. And that's what cognitive behavioral therapy is designed to do, is to help a person develop new skills to be able to develop the life that they want for themselves. And but this is sort of a way to kind of help a person realize things maybe for themselves, rather than having a clinician point them out. And
Sure.
but obviously there's a lot of clinical activity that's going on before and after the session, so people are having preparation and integration that's really important. And it's you're talking with your clinical facilitators who are trained guides and mental health clinicians. And so
So the before and after, there's specialists and clinicians that are helping you kind of as you enter the psilocybin part of the therapy and as you exit. And now during it, I think anyone who's even taken, recreational psychedelics knows that during the actual experience itself, the surroundings and the setting is really important. So in general, right, and it might be different depending on the study you're doing, but in general, what kind of setting are the patients in? And then I do want to talk a little bit about the pre and post as well, but what do you guys do to kind of keep that set and setting in a way that you think doesn't affect the outcome, or doesn't at least negatively affect the outcome?
Yeah, that's a great question. So, we use we very much take into consideration set and setting. So set stands for mental set, like the set of the individual who's taking the psilocybin, and it can include, the clinical facilitators as well. their mindset and their state of mind as they're there holding space for the participant. And then there's the setting, which is the physical setting that you're in. And so the preparation usually takes place in the same session room. You will have your session and integration in. Try and keep them, in the same room if you can, and try and eliminate, variables in which room you're in. But the preparation very much is about preparing the person to be able to handle what kinds of experiences they might encounter under the influence of psilocybin. And and just helping them feel safe in that experience to be able to let go. And so it's very much about building rapport and trust between the facilitators and the participant. And then that's really the major point of that preparation phase, is to really make a space for the participant that they feel as safe as possible and as comfortable as possible, and so that they can really just experience fully, what the psilocybin will bring to them, or bring about within them. And and so that's what prep is about.
And then the after, you said integration. I know that's a big word I've been hearing a lot about. So the integration process, is that kind of bringing back any self-realizations that people have had while they were under the influence of the psilocybin?
Definitely. So integration is going to be about, how do you take this really profound experience, or maybe it wasn't that profound for you. Maybe you didn't have that great or positive of an experience, which does happen for people. But there's a way to kind of take that and learn from it and make it a positive experience overall. Maybe it was challenging and difficult to go through, but you can learn from it and come out on the other end the better. And so in integration, you're going to be reviewing the experience. We have our participants write up a session report of what they had experienced, and then that's reviewed the next day with the participant. And
are those kind of surveys the primary output of the research? Or are you guys gathering and this gets back to that question of, hey, we might not have figured this out yet, but are there any biological markers you're measuring to see if any change occurred? Or is it primarily kind of the subjective surveys you guys are gathering to see, kind of measure efficacy?
So it's definitely a little bit of everything. So, we have some measures that we employ that we don't really ever publish on. They're more so investigational, and then there's the more like hardcore standardized assessments that we'll use to evaluate the pre-post changes. And so those are our like primary outcome measures, secondary outcome measures, and it's going to be dependent, or that's going to be relative to the the issue being addressed. And so like depression, you're going to use a depression scale. Anorexia, you're going to use measures for anorexia, so like weight gain, and look for psychological shifts. And we administer a lot of surveys that ask a lot of different questions, ask about changes in all different areas of life, and just it's very comprehensive. And then we also do take a lot of biospecimens, and will look for biomarkers that might be important in seeing these clinical changes. And but there haven't been any biomarkers that I guess have really been looked at, particularly to my knowledge, as being particularly important. But so we're looking sort of broadly, and we'll look at genetic things and epigenetic things as well. And
it's a lot of data. I mean, it sounds like you're going through a lot of data. It sounds like the intern Ian was on that front line at one point, going through those surveys, and and I guess part of the big work, and I would imagine you have a lot of people working on this, would be to go through all that data and try to glean patterns from it. I mean, just try to read this tapestry of information that you're getting back from people, from what is basically an ineffable experience. They can't always put it into words, and trying to figure out what the pattern is there and determine, is this effective? And I guess the ultimate determination for some of these clinical kind of ailment specific studies is whether or not that went away or not. So I guess that's the ultimate outcome. Now, how long typically after you do the therapy, how many therapies do you usually do? Probably different for each ailment. And then how long do you guys follow up with the patients?
That's a great question. So that's going to vary based on the study. So a lot of the studies we've conducted in the past and are conducting right now have fairly long-term follow-ups. So going out to like at least a year, sometimes more. And as for sessions, typically we've done at least 2 sessions for our studies where we do a lower dose and then move up to a higher dose. And we've typically used 20 milligrams per 70 kilograms as the lower dose, and then the higher dose being 30 milligrams per 70 kilograms. So based on a person's individual weight. And so our pharmacists, prepare the doses individually for each participant.
What we're talking about is like a psilocybin extract, not mushrooms. I want to, as much as we all associate psilocybin with mushrooms, and when I first heard about these studies, for some reason I thought you were administering actual, psilocybe mushrooms, but this is actually a derivative or an extract.
So it's synthetic. So it's not an extract. So that would require having cultivated mushrooms, which there are researchers doing work with cultivating psilocybe mushrooms at Hopkins. I'm not too familiar with what all they're doing, but we do not administer actual mushrooms to individuals. We administer a synthesized, lab manufactured psilocybin. And so there's a couple reasons for that. One being that it cuts out any other variables of like components that might be in the mushrooms that could be adding to the findings, could be confounding the findings. And so you want to eliminate those kinds of issues and uncertainties. And then also when it comes to doing pharmacological studies, you have to have a certain grade of substance. So it's easier ultimately anyways to just synthesize a lab grade psilocybin than trying to isolate and purify an extract.
When you say all that, it all makes sense to me. But part of me, and you don't have to speak to this, but part of me does wonder if some of the compounds actually within the psychoactive mushroom are acting as foils or cofactors to the psilocybin itself and guiding the experience in a certain way where someone who's taking the actual mushroom is getting a certain experience versus the synthetic. But at the end of the day, if they are taking the synthetic and getting positive effects, you would definitely want to stick with that for treatment, not necessarily assume that, hey, you can now go just take psilocybe mushrooms and you'll have this exact same effect. I mean, it sounds like in this setting, the prescription would then have to be, hey, you need to take this synthetic psychedelic to get the measurable effects we've seen before in treating this disorder. It's not kind of a free reign for patients like, yeah, go, take as many recreational mushrooms as you could find. Like that might not be a good idea.
Right. And, you never know what the potency would be for mushrooms. There could be, just different species have very different levels of the psychoactive alkaloids and in different, different proportions relative to one another. So like some might have a lot more like psilocin than psilocybin, and then some the other way around where it's like much more psilocybin present and a lot less psilocin. Or, maybe one mushroom species has a lot of the baeocystin and, and these other alkaloids, like who knows what they could be adding or taking away from the experience. There's definitely, a more negative set of physiological symptoms, I guess, with the whole mushroom, particularly like not nausea wise, but you know, people still experience that under, you know, synthetic psilocybin. So, you know, maybe some of those compounds and like inedible things in the mushroom, you know, are just, or not inedible, but, you know, not very well digested things that, you know, might cause your stomach to get upset. And,
sure. So it makes sense why you then use that kind of synthetic to take out all these externalities, focus on what are the benefits of this actual exact active compound. If we're going to make, you know, any prescriptions for people that have these issues moving forward, especially when you're talking about the realm of the FDA, you're going to have an extremely standardized chemical that you use for this kind of thing. And I totally get that. So I know that you're not a neurologist. You're not someone who knows necessarily the ins and outs of exactly how the brain works. But when we're dealing with some of these issues like anorexia, depression, when people are going through their treatment, they've been prepped, they're in the right setting, you know, the integration afterwards, what is happening to the brain maybe during the treatment and afterwards that's caused by, in this case, a psychedelic like psilocybin? What's actually happening in the brain that's making, you know, and I know you said we're kind of figuring that out, but are there any processes that might be happening that could speak to, you know, why change is able to occur in their brain?
Certainly. So, and there are a couple theories about exactly what's going on in the brain, but, you know, there's a region in the brain that involves, like an area in the brain that involves specific regions that, you know, intercommunicate with one another. That's called the default mode network. And it's sort of the parts of the brain that are activated when you're not really doing anything. You just like, your resting state, default mode. So you're just sitting there doing nothing. And, you know, think about what that state might be like in someone who's depressed. You know, they're having this maladaptive cognitive behavioral, you know, triangle, or CBT, or cognitive behavioral affective triangle of, you know, how you think, feel, and behave. And so, you know, you're having these negative cognitions, it's making you feel a certain way, and then you're then behaving in a maladaptive way that kind of perpetuates the whole cycle.
And that's kind of your base circuitry in your default mode network.
Right. And, you know, that's from the experiences you've had. You know, you've been conditioned to be the way that you are. And then an experience that, you know, a psychedelic can induce can interrupt the activity in the default mode network of the brain and start to establish, you know, different kinds of connections that normally aren't made. So there are parts of the brain in the default mode network that are communicating with one another that typically don't. And so there's a theory, or a model called the entropic brain model that kind of looks at like the entropy of the brain. And so during the active, you know, acute drug experience, the entropy of the brain is thought to go up. And so there's more like chaos in the brain and less organized structure. And so there's, you know, a lot of intermixed communication in the brain that is abnormal. And, you know, I guess the way I've heard it explained is that there's a reduction in the gating or the inhibitory parts of the brain. So you're accessing more stimulus or information that you're constantly perceiving. It's always around you. It's always there, but it's then becoming conscious. You're having less of the inhibitory parts of the brain be active and kind of quiet, you know, the static be released. And so those brakes are released. And so, you know, people kind of explain it as like they're making new connections and they're seeing things differently. And, you know, maybe it's because they're having these different, you know, physiological connections in the brain, allowing them to form new associations between experiences and stimuli they've experienced, and then be able to reframe the way they think about themselves and their world and, their place in it. And,
that's fascinating. I mean, I know that's a model and it's still, but that's absolutely fascinating to think that, and from what I'm taking, just to rephrase to try to let my brain cope with it, it sounds like, there's billions of like data points or inputs that your brain could pick up on. And, with your default mode network or your kind of standard operating system of your consciousness, you're kind of shuttering a lot of that out because you need to be able to operate in, the real world, and you can't be just bombarded with every sensory input. But, when you actually have that psychedelic experience, that theory sounds like it centers around basically letting all those inputs in, and then based on this new sensory overload, your brain might actually make new connections that then kind of, as you come out of it, settle into a new default mode network. I mean,
right. Yeah.
That's fascinating.
Yeah. And so that's why integration is really important, because someone could very well revert to sort of the same patterns of being that they, that may have been causing them issues previously. And then they haven't, made any progress really. Maybe they've gained new perspectives, but they ultimately haven't established the new conditions and ways of being that are adaptive and healthier for them. And so integration is very much, I think, a way to help recrystallize the brain's default mode network to the adaptive and desired state, with the help of, your supporting guides, and, hopefully you have a supporting environment to go back home to. And, that definitely can be a factor in how well you can integrate. So, and those are things that are still being investigated, but, if you can restructure the way you just think about yourself and your world, that's incredible.
Yeah. We're putting it in very malleable terms so we can kind of conceptualize it. Yeah. That idea that you're kind of like blowing apart the crystalline matrix of your brain and bringing in all these new inputs and then recrystallizing it as this kind of new formation, and to think that can be affected by the inputs you get during the therapy, by the inputs, the integration that you get after the therapy can help crystallize it into like a structure that's more better adapted, and maybe you can overcome some of those like I like the word you use, some of those loops that people get stuck in with their behavior. Because behavior is so hard to change. Anyone who's addicted to like even just addicted to sugar knows how hard it is to like not go after it. So it would seem like a process like that would offer a lot of hope, especially because it's not invasive. You're not, opening up someone's brain literally and trying to reconfigure it, which, but you're doing that in another way. And I guess, learning how to manipulate that process more effectively is kind of the whole point of the research you guys are doing. But it sounds really promising.
Yeah.
It's out for people like me. I mean, it sounds like, a great path for medicine to take, because I think there are a lot of people that don't necessarily trust some of the medical models the way they are now. And so to have some more holistic or things that seem like they aren't down the same allopathic line of treatment is really promising.
Yeah, definitely. And it's something, with this kind of model of, with psychedelic therapy and the default mode network, it can then be broadly applied. That's why we can try and look at different things, because the default mode network is implicated in a lot of psychopathology and has like these sort of programmed ways of being. And, different brain regions are communicating frequently, like in someone who's anxious, they have an overactive amygdala, which is, often called the fear center of the brain. It does more than just process fear, but, it is activated when someone experiences fear. And so like, that's very active in someone who's really anxious and is experiencing like the fear and anxiety often, of their environment, or, whatever is the focus of their anxiety. And so, it's really interesting to see it be applied to a lot of different things. And it really is much more holistic, because it's, it's you're experiencing yourself. You're not having someone else
Right.
interpret who they think you are, and like, try and help you change from their perspective of you, but rather you can start to change from your perspective of you. And, it's a very personal internal experience. I mean, we have our participants lying down on a couch with a blindfold and headphones on the majority of their experience. And we encourage them to, really immerse themselves in that, so that they can really let go and just be in that state. And,
I mean, pull the healing from within. Because I think that's a great point, is that even if you think about non-invasive therapies like psychiatric therapy, there's still another consciousness involved projecting potentially their stuff onto you, which, so the idea, and God, someone I love and respect a lot, my partner actually, always tells me that a true shaman is one that shows someone how to heal themselves, how to draw healing out of themselves. And I don't want to just throw around the word shaman, because it is thrown around too much now. Everyone's a shaman, but just that idea that like a true medicine man in some ancient traditions was the one that would help you go inward like that and actually pull out the healing, because healing yourself is really the only way that it's going to last long term. I would think, especially for a mental, psychological issue, you're the only one that can change your own psychology in a real way moving forward.
Exactly.
That's a great point. Now, we've been talking about, specific kind of treatment research. So I would imagine that patients you guys are selecting have to, meet the criteria of actually having these afflictions. But how do you guys find patients? The reason I ask, I do get questions about this. People that say, I have cluster headaches, or I have a certain ailment. Do you know of any way that I can get involved in a psilocybin assisted therapy study? And, I kind of point them either in your guys' direction, or, MAPS, or one of these organizations that deals with these kind of studies. But how do you guys get patients, or maybe how can people get involved in these kind of studies?
That's a great question. So there's a lot of different ways, I guess, you could be involved. But like, if you're interested in participating in studies, there are a couple different types of studies that are going to be out there. So there's survey studies like we've conducted, like the one I mentioned, the death survey, which we have one right now called the Insight Survey that's posted on our website, hopkinspsychedelic.org. And so that's a place where you can also see what studies we're conducting, and can find information about those studies, and find links to be able to apply. And fill out, pre-screeners online, answer some questions to see if you might be eligible. And so that's a great resource, our website. And then there's clinicaltrials.gov, which is an amazing resource, which you can search, any study that's being conducted, and that's, listed on that website. Most studies are. And, at least in the United States, you're going to be able to find like pretty much all the studies that are happening. And so you can search keywords. You could search psilocybin. You could search psychedelic. You could search depression. You could search like psilocybin and depression, and like see studies that are looking at those issues, or, PTSD and those things.
Oh, that's really great. I mean, that there's an easy way for people to interface with that. And now that's great for me, because now I have a better place to kind of point people when they ask, how do I get involved? It can be a little bit more helpful. So do you have some studies like the death study? I mean, are there some studies that don't require you necessarily to have an illness, but you're a healthy participant and they just want to see how your brain reacts given your circumstances? And even on those healthy studies, I want to also talk a little bit about, why it might not be right for some people.
Sure. So so we do have healthy volunteer studies. We are looking at a host of different things with those studies. Some like basic science research, like basic neuroscience research. One interesting study that I've been a part of is a study that's has administered psilocybin to religious professionals, and so that's a really cool study that we're looking at. How maybe these individuals who have a rich understanding of non-ordinary things, of like mystical experiences. They're very often recounted in religious contexts, and see, maybe do these people have a unique ability to interpret these experiences and share them with the rest of the world, and help us better understand the nature of what people experience, and
they're able to really, maybe those people have a better chance to really see God. That's the common psychedelic experience. You will see God, or maybe they actually do if you put a priest into this kind of therapy. That's really interesting. And yeah, that idea that people already a little more spiritually attuned might be able to pull something back from that other side that is really unique and has, maybe has, because they've kind of been in those quote unquote mysteries and spiritualism, they have an ability to grasp it and kind of almost manipulate the experience a little more deftly than your average person. And I know I threw out there at the end of my question that I just said, that was kind of its own huge universe. And I don't actually want to throw it in as the end of a question, because I know before we even interviewed, you said you did want to make sure we talked about, the dangers and that psychedelics aren't a panacea. We've already talked about this is a synthetic form. You're not just taking an entheogen that's loaded with other compounds. So what are some of the dangers associated with this? I mean, I don't want to encourage people to do this outside of a clinical setting. And, what are some of the dangers that people could run into if they just think that now that they can do this recreationally and get these results?
Thank you. I appreciate you bringing it up, and because it's very important to have that conversation and to make it known that these substances do have risks associated with them, and that's a large part of why we employ the set and setting kind of protocol. Really making it intentional and preparing, and helping a person feel safe and comfortable. So the context you're in, the setting you're in, it matters what you're around when you're having this experience, this profound ego dissolving experience. You want to be somewhere safe and be in the company of someone who's trained to help you through those kinds of experiences. And so part of that is because these experiences do have the potential to result in persisting psychiatric issues. So, maybe, like some people will come out of these experiences, more distressed and disturbed than they might have already been coming into it. If it was like a clinical study, not everyone gets better after having psilocybin. And, like you said, it's not a panacea. It's not going to help everyone. There were people in our depression study who, maybe didn't really see any significant results, in change in our pilot depression study, while some people, saw much more dramatic changes. And so there are going to be individual differences for, who might be the best to benefit from these issues, from these substances, and for different issues. And there's also certain conditions that we try to identify, and it's kind of customary in psychedelic research to not work with certain populations. So there are certain psychological issues that can be exacerbated by an experience, from something like psilocybin or LSD, psychedelics. And
we're talking about the kind of decrystallization, opening up, and then recrystallization. I know that in that model, that's the model I like. It helps me grasp it. So in that model, for people that already have, the kind of that untethered nature, something, immediately my mind thinks of schizophrenia, someone whose, brain current default mode network is really maladaptive and not functioning properly. You don't necessarily want to just open that up to all new inputs. It could send them completely down the wrong path. And I'm sure there are other conditions too that you really have to select out for. And that's probably part of your pre-screening. But I did want to mention that because, a lot of people are supporters. A lot of people have good experiences recreationally, but I don't want this to be a free license to say, oh, I'm going to have all these positive health effects or going to improve myself. It's not that simple. And I think, as you're pointing out, having an extremely controlled setting and having guides, I mean, having people that understand the experience and understand how to hold that space to let you have that experience in a safe and effective way is really a huge part of the therapy itself. So divorcing the substance from that aspect of the therapy feels like you're kind of entering a territory that what you've been speaking to and what the research has been speaking to doesn't really cover. So when you're just going to take the substance and run with it, the outcomes and the things we've been talking about, kind of, you can't expect that.
Exactly. I couldn't have said it better myself. That really, is the heart of it. And, and especially, the media likes to kind of make it seem like, it's, you just take this pill and everything's resolved and like you're cured and you're fixed, your depression's gone. Maybe people feel that and experience it acutely, but the, ultimate truth is that, you're still having a lot of things to work through.
Right.
This experience is essentially giving you the tools and helping you find the grounding to start working on yourself and doing things that will help you see the changes that you want to see in yourself, and to, have the life that you desire. And, so it isn't just as easy as taking a pill and then you're fixed. Like, it really, the integration process is the longest part of, psychedelic therapy. And it really is the most important part, because if, regardless of what kind of experience you have, if your integration is poor, your outcomes are much more likely to be poor compared to if you really integrate well and you really bring that change and, the profundity of that experience into your daily life. And really, like you mentioned earlier, people experience God, like, really being able to tap into that more regularly and to like bring that into a daily part of your life and connecting back with those emotions and those feelings, the feeling of being interconnected with everyone and all things, that's a really profound experience. And if you can tap back into that, then it can maintain its, strength and its potency and affecting your life. But if you don't, and you kind of lose touch with that experience, then, you're probably not going to be living with that as much in mind.
Well, it's the word, right? You didn't actually integrate it. And I think
Exactly.
That's such a huge piece, is being able to access, back, I think everyone in their youth or in their, late teenage years, whatever it was, had an experience with psychedelics in our modern culture. And I think for me, one of the huge takeaways was that feeling of connectedness, that feeling of like, we're kind of all one thing. We're all, and I think for me, it ended up being this thing, classic Alan Watts line. Sometimes you get the message and you hang up the phone. Like, right. I didn't need to do it again because I got the feeling, and I was in that kind of environment, maybe by luck, where it did kind of get embodied, and you are able to then walk away with that knowledge and with that feeling on a cellular level of like, okay, I'm connected to everything. Get that perspective in your day-to-day life. And I think that should be the goal, not to put yourself on this trail for, continued psychedelic therapy. Now, some people probably need that. People dealing with, real clinical issues and real like psychological traumas and issues probably do need more than one therapy. But just in general, I think the overall goal should be kind of a path to where the experiences you're having, the takeaways you're having, are implemented even in your non-psychedelic life. I think that should be the goal of the therapy in my mind. So kind of on the heels of talking about the dangers and some of that, I do want to ask a quick question. I want to shift a little bit to kind of Ian personally. I think we've done a great job covering the research unit. And I think, I do want to shift to what you personally learned from it, because I think you're a great touch point for people like me who are younger, interested in this stuff. I want to know, you personally, how do you feel about the movements out here in Oakland? It's a big thing, and some other cities I know are going through this right now, but the decriminalized movements in the context of you doing research, and having these effects, but like we said, there are dangers. How does this mesh with decriminalized movements? And is it kind of all one thing, or is it kind of two separate, or is it separate tracks? And then you can always tell me, hey, I don't really want to talk about that. We can do that too.
Yeah, I'm happy to talk to it a little bit. So I would have to say, like, ultimately, I don't believe that drug use should be criminalized. I think just looking at the like anthropological perspective of human history, like we have continued to use substances and, for various reasons. And, look at alcohol, like that's recreationally used, like that's a substance that doesn't have really like the medical accepted value that comes to my mind is as an antiseptic,
Right.
And so, like, I don't know. I don't think drugs in general should be criminalized. I think they should be regulated. I think it's important to make sure that drugs are regulated in a way that, they're kept in safe hands. They're not being, like opioids, that's become a major problem because physicians have just prescribed them very freely. And now, that's a problem we're now dealing with, with opioid addiction being a very large global crisis. It's affecting not just our country, but other countries too. And so it's important to make sure you're properly regulating substances, in my opinion. And I would see that the two efforts are pretty separate. Although maybe people are part of both movements or support both. Sure. I think they are separate because ultimately, like, the medicalization approach is looking to get these substances to help people and also figure out, why we shouldn't give them to people, and what cautions we need to be taking with these substances, because not every substance is, it has its different problems and concerns that need to be had with them. And I just believe in getting it through the FDA and really understanding the science behind it all, and really, having the best perspective on these substances before we, kind of roll them out to the world. Because I just kind of look at the medical cannabis industry, and it's very much something that has subverted the FDA. It has gone through, different chains, and it's not really based on science or medicine. I mean, I don't really believe in that system that much.
Right. Kind of the anecdotal, hey, we've all had these powerful experiences. We've all had these effects. It's out in nature. We should just have complete, unmitigated, unregulated access to every member of society. And, I'm not sure where I fall on the issue, so I was curious to hear from you. And for me, it's just big to hear that these aren't necessarily the same track or even necessarily parallel tracks. It's almost more like, if anything, they're like sequential tracks. Like, hey, we should get it really researched to the point of FDA approval. And I think this is one of the really good parts of Western medicine is we do break everything down to its constituent parts, and really figure out what are the exact chemicals, however many there are, what are they doing. And then, I think more what you guys are doing is taking a holistic approach too, to see what does the whole experience look like. And I think if we can get a codified understanding of both the components and the whole experience, where an organization like the FDA, which to some people is kind of a faceless monolith, to get it to a point where it has enough rigor and understanding of all the constituent elements we're dealing with to where they would deem it as acceptable, and then release all this research about what's acceptable. I think that makes even the recreational user, even the person who's arguing, hey, this is in nature, I should have unmitigated access. If we get it to the point where we know to the nth degree all of its effects and what it's made of, that makes the experience better for everyone else. And then, there's an argument about morals and all of that. And I totally get it. even if it wasn't centered around institutional organizations, I just think the sequence of events you're describing is probably the safest, even if it didn't have to be approved by the FDA, but to bring it to that level of rigor so you really understand it inside and out is going to make it safer for the eventual rollout potentially to more people.
Right.
So that was a really big way of kind of getting my thoughts together around that. But it is a big issue that, a lot of people are dealing with right now. Like I said, in the Bay Area, it's a big hot button issue because Oakland just decriminalized entheogenic plants. And so I'm kind of taking everyone's opinion and feeling out my own opinion on it, and talking to you adds another layer to that I think makes a lot of sense.
Definitely. I mean, I would say that, like, when you take or consider taking the path of like going through the FDA, really investigating these things empirically, you're ultimately going to come out in the end knowing the most out of any of the different paths, because you're going to really look at these substances and, like you said, identify all of the little details and really understand much more fully what's happening, and particularly understand safety issues, and that's really important. And when things get legalized prematurely, like cannabis is a great example, because you can look to states where it's like it's legal, but you still can't even investigate it federally. And so, like, you need a special license to do any sort of Schedule I substance research, and so it's very restricted. So there's a bunch of people who are using cannabis without really knowing what the potential harms or benefits are, and I think that's a disservice to the to the consumer to not be able to give them full disclosure. And so I think that's an important thing to really establish is the knowledge, and to know what's going on. And if and another good example is like ketamine. You don't see a lot of ketamine research going on right now because it's a Schedule II substance. It's authorized for medical use. It has an accepted medical use, and so like there's these ketamine clinics popping up all over the place where people can get ketamine therapy for depression. And it has shown to be effective, but there's not much more research that's going on into the effects of ketamine on depression. And because it's authorized for medical use, it can be used for off-label purposes. So those things aren't going to really be investigated. They'll just be like adapted, and then we won't really know the science as well on those issues and whether or not it's really going to help people, because it's not being held to the level of scrutiny that it might be expected to.
I think it's just good for everyone involved to have that level of scrutiny. I know myself, as a potential, I don't really have any ailments that would necessitate psychedelic or psilocybin use, but just as a potential recreational user, it feels to me like, I would really like to have it mapped out to the point of fully understanding it before we, roll it out to people all over, including, my friends and family. I want to think that there's been this layer of really thorough examination that's been done. But like I said, I know it's a big issue. I know people have opinions on every side of it. I don't think anyone's wrong, but I think it is requires a lot of thought and diligence to be sure. So I know we've been talking for a long time now. I do want to talk a little bit about your personal viewpoint. So we'll go a little bit kind of bullet points, but overall, I think I know the answer, but overall, how do you like working at the Psychedelic Research Unit? How do you like the field of work that you're in right now? Do you feel like you're really making an impact?
Yeah, I mean, it's really a true privilege and honor to be a part of this mission. I mean, it is a dream come true for me. And, there are certainly days where it's not like easy or necessarily the most pleasant work day. There might be things that are just really annoying or difficult to handle. But, I think that's just the nature of a lot of work. Work is work. Like, it's not always going to be easy or just like simple. And so, and a challenge is fun. I definitely can think back to times when I've like not been challenged and think of like how bored I've been. And so it's good to like, have some hard days, I think. And, and it really is awesome to just be working there and working under, some really amazing scientists, and to work alongside with a lot of really amazing clinicians, and, to be a part of this effort to help many, many more people in the, future to come.
Yeah, that's great. That's great. And I was going to ask, I had it marked here, what's Dr. Griffith like? Assuming that you're not starstruck anymore and you've developed a real rapport with him. What is Dr. Griffith like? Is he genuine? Is he good guy, nice guy? I assume all these things, but
very much so. Yeah, no, he's very much very genuine and kind individual, and he gave me his blessing to come on to this podcast, and I very much appreciate that. And I couldn't be more grateful for the work he's done, because it's laid the foundation for the work that I want to do and see myself doing. I mean, I can't see myself really pursuing any other, profession. So
at this point, you've been inoculated, as we say. And,
yes.
And actually that led right into my next questions were kind of about your future. And, it sounds like you do want to continue in this field of research. Do you see like more labs popping up at different academic? I mean, is eventually this kind of, maybe within other behavioral pharmacology units, because I guess there would be more of those at different institutions, but do you think there are going to be more dedicated research units to psychedelics popping up? I mean, it sounds like, out here, SFSU has one, NYU, Madison, there in Wisconsin, University of Wisconsin. But do you think this is going to become a much more common thing?
Definitely. I mean, there's a lot of institutions right now that are involved with psilocybin research and other psychedelic research. And, it's just continuing to grow and gain more, grounding and like validity in the scientific community. So as that continues to be established more and more, and, I definitely expect to see more centers be opened up. And yeah. I mean, I'm excited to see what comes next.
Great. And I'm looking forward to reading your future scientific papers and the research that Ian is organizing. I think it will be cool to kind of follow. I mean, I'm going to stay in touch with you, and I think it's be really cool to follow along your personal journey. And actually, I'm actually from the Baltimore, Maryland area. My mom worked at Hopkins for like 30, 40 years. I should know that number. But yeah, so it's really interesting for me. It will be to follow your journey, and I'm really glad we got connected. So I guess as we wrap up, what are those websites again where people can sign up to get involved in kind of the patient side of it, to sign up and get involved in the studies?
Sure. So our website is hopkinspsychedelic.org. And then there's clinicaltrials.gov. And then another great resource is, and I think you've mentioned it earlier, is maps.org, which, it's multidisciplinary association for psychedelic studies. So that has a lot of information on it, from, integration therapists to different research that's going on throughout the world with different substances, and all kinds of stuff there. That's really great resource. And then, for those interested maybe in the depression trial that we are part of, that we're one of the sites for, you can check out the USONA Institute website, which let me just make sure I have it correct for you. Yeah, it should be usonainstitute.org.
Perfect.
And yeah,
I'm going to grab all these links from you. So at the bottom of my podcast, wherever it's posted, we'll have all these good links for you guys. And it's a question that totally slipped my mind up to this point. If people want to follow kind of more your path and be involved in the cutting edge of the research, do they need to have kind of that hard science background? How can people get involved in, this effort to move psychedelics out of the darkness and into the area of therapy?
It's a great question, and it's definitely one that a lot of people will call us asking. And the best advice that I could give would be to encourage individuals to kind of find their area, what you're interested in and can, what you might be good at aside from psychedelics that you could then bring into the movement of, maybe you're interested in like conference planning. You could be a part of conference planning for, different conferences that, disseminate psychedelic information and science. Or maybe you want to be doing much more of what I'm doing and you want to be involved in the actual day-to-day research and or like the clinical facilitating. And so if you're interested in doing that, definitely reach out to the institutions that are doing this work, identify those places and send an email to the principal investigators, just take the leap and, because you'll never know the outcome if you never try.
I think that's great. I think that's fantastic life advice for anyone's passion. And I appreciate what you're saying is, make sure you have, or that, we all have skill sets, and make sure you really understand your own skill set and what you can bring to the table. And then, don't be afraid to reach out and get involved. I think as more of this research proliferates, more organizations that are actually kind of orchestrating the research, like USONA, like MAPS, these organizations do need people in so many different capacities. Maybe you are just great at holding space and you are, or, whatever it might be, everyone's got some skills they can bring to this. But, maybe the entry point isn't, hey, I like taking psychedelics. It's like, no, think more about practically what you could do and then find your entry point that way.
Precisely.
All right. Well, that is the clarion call to everyone. Find your entry point. If this does fascinate you as much as it does me, really don't be afraid to get involved out there and don't be afraid to use some of these resources to learn more. It's an interesting, incredibly expansive topic. We've already talked for like an hour and a half plus, and I feel like we're only scratching the surface. So hopefully we'll have you back for future interviews, tease this out more. But yeah, I just really appreciate you taking the time to be with us. And I'm so grateful to our man, Dr. Griffith, for letting you come on.
Definitely. Thank you for having me. It's been a true honor to be here, and I really appreciate having the opportunity to share. Thank you.
All right, Ian. Well, until next time.